In this second video, we will continue working with the idea of pain, but in this case, we're gonna assess pain. So let's see. Do you remember this image from our previous video, from the previous presentation? Well, you can assess pain by mentioning that there is no pain, mild pain, moderate pain, severe pain, very severe pain, and unbearable pain. But you know that when there is a pain in your body, it is not always the same. Sometimes it could be mild and then move to be moderate, or it could be very severe and move to be moderate. So how can we express this in English? Observe this report. Alma Rosas is a retired woman. She is 65 years old. She arrived to the hospital reporting a liver pain. It began 1 week ago as a mild pain, but it is getting more severe. She feels pain in the abdomen, her back, and when she breathes. It hurts all the time and it gets worse when she walks. It's stabbing and constant. Nothing can make the pain feel better. Okay? So if you observe, we can have here the different levels of pain, but also the evolution of the pain. So we're going to express this by using comparatives. You may remember from previous courses that comparatives are used to compare two people or things. It is important to remember that it is two elements to be compared, only two. So, what is the general rule? Well, if you have one syllable or two syllable adjectives, some of them, you will add er, the suffix er, to the adjective. For example, mild will become milder. Here we have an example. The pain is milder now. Or you can also use the expression with the suffix er and then than. In this case, if you observe, it is similar to what we have here in the presentation because we are just reporting the pain, for example, but it's getting more severe. The pain is milder now. But if you want to emphasize the comparison, you can use the particle than. For example, the pain in her hip is milder than the pain in her arm. So in this case, if we are using than, we are indicating which are the two elements to be compared. In this case, the pain in her hip and the pain in her arm. That is why we have than. What happens with longer adjectives? With some two-syllable adjectives and three or more syllables adjective. So we're going to use more. For example, effective. So how many syllables does effective have? Effective. It has 3 syllables. So we're going to use more. Here's an example. Treatments today are more effective. So we can imply, we can infer that we are comparing treatments today than treatments in the past. But it is not necessary to mention it. But if we want to use than to mention the difference, we're going to say something like, this treatment is more effective than the previous one. Now we have a point of comparison. Observe, more effective than. There are some exceptions. It means some irregular adjectives, for example, good and bad. In the case of good and bad, we're going to have better and worse when we are doing comparisons. For example, I'm feeling better today or I'm feeling worse today. Or we can use than, for example, the herbal therapy work better than the painkillers. Okay, so we are comparing here two things. Herbal therapy with painkillers and we are using better. Sometimes we don't want to compare two things. We want to emphasize that one thing is better than one in a group. So we're going to use superlatives to compare 3 or more people or things, elements, okay? And we're going to follow the same idea here. We're going to check how many syllables or adjective has. For example, if it has 1 syllable or 2 syllables, we're going to use the, that is very important to remember the article the, and the suffix est. For example, we're going to use again mild, the mildest. So here's an example. The pain in her hip is the mildest in her body. If you remember, in our previous example, we were saying that the pain in her hip is milder than the pain in her arm. But we are mentioning that she has more pains, and consequently, the pain in her hip is the mildest in her body. Okay? Then we also have longer adjectives, and we're going to have the same idea. We're going to have the, and in this case, we're going to be use must. The most, for example, the most effective. Heat patches have been the most effective to relieve her pain. If you observe in this case, we don't have any other way to use superlatives. We only have the article the and the suffix or must. We don't have something else. In the case of comparatives, we were using or we have than. And again, good and bad are exceptions. So we're going to say the best or the worst. For example, the best solution was taking some painkillers. This call is the worst in her medical history. Okay, so these are some ways in which we can do superlatives. But if you observe in both cases, we're emphasizing the fact that they are more. So we are showing their superiority with more and the most. But what happens if I don't want to show the superiority and I want to show inferiority? This is easier to use because we only have one rule for each. If we're using comparatives, we are always use less. No matter if it is 1 syllable, 2 syllables, 3 syllables, no matter, we're going to say less. For example, in the comparatives. For example, the treatment was less successful than we hope. Menos, exactly. And then we have superlatives. Then we have superlative, the least. And we always use the least, no matter if it is 1, 2, 3, 10 syllables. For example, music therapy was the least effective treatment. Okay, so we can compare with superiority using superlatives when we have 3 or more. We can use comparatives when we only have 2 elements, or we can talk about inferiority using comparative with less and superlative with the least. For example, if we want to ask our patient what relieves the pain or what makes the pain better, so if we want to know what makes the patient to feel better, to feel healthy, we can use these questions. And in this case, we can use comparatives and superlatives. Well, in this case, in this example, we have comparatives. For example, taking a shower makes the pain more moderate. So let's imagine that the pain is moderate, but if you take a shower, the pain will be more moderate. Or you can say this, if I lie down, the pain is less severe. Remember, these are the questions that you as nurses can ask, and these are the answers that your patients can give you. Then we have this. What increases the pain? Or what makes the pains worse? Okay, relief is when you feel better. Increase is when you feel worse. For example, walking makes the pain more unbearable. Unbearable, it has many syllables, so that is why it is more. And then when I carry my baby, the pain is worse. So these are the ways in which we can use comparatives when we are talking about pain relief. Here I have another example. And observe how I'm using superlative comparatives. Alicia Robles, a 22-year-old woman, presented to the hospital with a severe pain in her right ankle. According to her, the pain started 2 days ago, but today was the most painful day. Ranking 8 in the pain scale. You know the pain scale, right? The pain was stabbing. After the prescription of some painkillers, the pain was more bearable. She mentioned hot water bottle made her feel better, but walking made the pain worse. So this is the way in which we can use comparatives and superlatives when we are talking about pain. So are you ready to practice? So please go to the following activity in Blackboard, and we will continue with this topic in the following video.